In today's video, we are going to talk about what happens after KP exam, what is the procedures to be done, what is the changes that can occur and how to tackle with it. Hello everyone, this is Dr. Swapnil Chandratre here. When you clear your KP exam, you are done with your permanent license. Then you don't require any exam for the further process. When you are done with your KP exam, immediately you can apply for your permanent license. For that, they will ask you some documents. Those documents you need to submit, like a work contract and all those things. With that, you will get the permanent license. Now, when you get the permanent license, there are three directions you can go. There are multiple options you can do for your future. The first option is to shift from the Germany. You have to understand that when you have this permanent license, this license is valid in entire Europe. When you go to any other country, that country will have their own language. You might need to give the FSP exam of those countries. The countries in which the German language are spoken, for example, Switzerland or Austria or Luxembourg, there you might not require any of the exam. You can just directly apply with your documents. Most of the time, they might do some recognition process there. When that degree recognition process is done, you don't require to give any separate exams there, and you can also work there. That is the widening option that can happen. I'm not sure about the Ireland, because Ireland is the only English-speaking country right now in this union, because UK is out due to Brexit. Now Ireland is the only English-speaking country which is there. I'm not sure about the Ireland. Maybe they also require IELTS or something like that. I'm not 100% sure. The rest of the countries like Italy, Spain, Netherlands, if you want to go there, then you can go. Only thing is that you need to give their FSP exam there. You don't need to give the KP exam. That's the first way you can choose to do. You change the country. The second option is to do the PG. Doing the PG, you already know, and I have spoken many times, that PG is not here the university education. It's like a job only. You just need to apply to the clinics which are providing the PG. PG here in clinical branches are only in orthodontics and oral surgery. You just need to apply to those clinics. It's a combination of practical portion you do in the clinic. For theory, you need to go sometimes to university. That's a combination study. You will keep on earning the amount which you are earning at the end of your FSP portion, or I would say that in the range of around 3,500 to 4,500 euro, depending upon the clinic. That much money will be good enough for you to survive. Also, you can parallelly finish your PG. Now, the third option is regarding the continuation of job in Germany. If you just want to continue, you don't want to do all this stuff, you want to work as a general dentist anyway, if you are not from any of these branches and you just want to continue like that, you can continue working in the clinic. If you are continuously working in the same clinic, for example, if you have worked in some clinic during your temporary license time and now you have your permanent license and you are continuously working, in that time during this period you might have earned the trust of the doctor. He or she will be very much happy to continue with you. In that scenario, you have the right to earn in his salary plus the incentives. What are generally these incentives? Incentives are the fixed salary plus percentage. Your fixed salary may be in the range of 3,500 to 4,500 euros. After some amount, maybe 15,000 or 20,000, you are earning 15 to 20% during this 2 years time. That is different from clinic to clinic and different from what amount of money you are bringing to that clinic. If you feel that you are helping the clinic to earn more than that, then you have the right to ask those things. You can talk to your boss, ask them for this percentage thing, and with that, you have the possibility to earn double than your fixed salary. You will have the fixed salary plus incentive, and that way you can earn very much handsomely. You can live a very luxurious life. If you decide to change any clinic, or if you decide to change any city, or whatever the reason you change the clinic, in that scenario, most of the time in each and every clinic, first 6 months are considered as a proboscite, which is a trial period. During that time, they might not give you this percentage. They see during the 6 months time that how capable you are, how much money or revenue you are generating for that clinic, and then later on after 6 months they will provide you this percentage. If you want to start earning in a percentage, good, and it's the best way. You work in the same clinic if you have that kind of possibility. If that clinic has so many patients, in that scenario you see that's a very developed clinic, then there is a possibility to earn more and grow more. That's the one way on good money. It is very important to know that after clearing your KP exam, you need to finish your assistant side. After KP, you need to do another 2 years of assistant dentist side. During that side, you are ideally not allowed to open any clinic. I would would also refrain to open the clinic that very fast, because here the bureaucracy is very difficult. It's not like that easy to run a clinic like in our country. Here there are many norms, the staff problems and all those things you need to also consider the bureaucracy. Ideal way in the beginning, you finish your assistant dentist time with this percentage. It doesn't matter whatever the position you have, you will be earning a good enough money if you are sticking to the same clinic where you are already working. There is another option of doing any specialization. For example, if you belong to the perio, prosto, endo or pedo or all this kind of branches, first of all you need to understand that your PG is not valid here, because there is no PG in these branches. You don't need to repeat it, you don't require it. What is the option to put yourself in a specialization position? Well, if you plan to work in a big city, if you want to live in a big cities, then it's better that you will have some degree behind you, not just a general dentist, because there are more amount of competition is there and people see this kind of titles. There is a possibility to do this MSc course. Those are the paid courses. It is in multiple branches like endo, in perio, in implants, laser, aesthetic. All those branches have these MSc courses. After these courses, end of your title, you get the MSc, whatever MSc endodontist or MSc implantologist, and all those things will be added to your degree. That is generally, as I said, the paid course, generally in a duration of 3 to 4 semesters, 1.5 to 2 years time. Costing of the course depends on the course, comes around 20 to 30,000 euros. That's very costly one. If you plan to settle in big cities or something like that, for your growth you will require it. If you are in tier 2 cities or in villages and all that, then you don't require this kind of stuff. No one sees what is the degree and all that thing. These are also the options you can consider. I am just telling you based on my experience that after the KP exam, when you start earning with the percentage, when you are done with all the exams, then you will really feel the worth of whether you have done the right decision or not. I am very happy with my life right now, because I am living a very good life. I am earning also very handsomely. I have a very good work-life balance, very good respect here. In the end, after the KP exam, you will feel that you have taken the right decision. Some people might have some bad experience, cannot comment it. It depends on a lot of factors, that where you are going, where your job is, how continuously you are working there, how good you can work. A lot of factors come into place. That's why everyone have their own journey. But in general speaking, when I see and when I talk with every dentist and when I see the scenario, I would say that it will be worth it, and you are done with your KP exam, then you can live a very rich and very luxurious life. I hope that I have given some idea about what to expect after you clear your KP exam. If you have more doubts and if you want to execute the process right way, you can always contact me. The link is in the description box. Till then, have a nice day.